Oftentimes people will say, well, after I leave the hospital, do I go to a rehab unit or can I go home or what happens to me? I tell people it's about passing the test. And what does that mean? That means that physical and occupational therapy tell me that my patient's able to get in and out of bed, go to the bathroom, walk up and down the hallway, go up and down steps, get dressed, and can take care of themselves even if they're by themselves. And I let literally 80-year-old people go home by themselves if they're safe. And we tell them ahead of time, have a neighbor, a church friend, a family member, somebody stop in once a day to see if they need something from the store and to make sure that they're doing okay. But the patients, when they take control of their own care, they tend to do better rather than going laying around somewhere expecting everybody else to do it for them. As far as therapy itself, the patient's the therapist. In other words, if you don't do your exercises that we teach you in the hospital, you're not going to do very well. And doing the exercises means that you have to do them. It's not about having a therapist come by to see that you're doing them for 30 minutes, 3 times a week, but yet the other 4 days you don't do anything, and the other 23 and a half hours you don't do anything. So I really teach my patients ahead of time what's expected of them after surgery, and you're the therapist, and then we follow you in the office. Certainly if you're not hitting the milestones for whatever reason, and sometimes that happens, then we will get you into therapy to get you caught back up where you needed to be. When I first started, I used to send everybody to therapy for a solid month. And what I found that some of my patients who did not go ended up doing pretty well. So for knees, we focus on getting good range of motion and controlling pain and swelling the first month to 6 weeks. Once we accomplish that, then we start adding a lot of the strengthening exercises, because I have the rest of your life to get you strong, but I've got a short period of time to get good motion before you scar down from the healing process. So that's kind of how I've done things, and we've noticed that our pain medicine consumption has gone down because we weren't asking muscles to get stronger 10 days after surgery after we just had our hands on them. We let them heal some before we start the strengthening, but it also hasn't held people back. People are still able to get out and start golfing early on, walking early on, so it didn't slow their return to function down at all.